Your legs are trying to warn you. And by the time you feel it, it may already be affecting your heart. Doctors see this every day after 60 and almost never explain why it's happening. 1 in 3 people over 60 have this and don't know it. Welcome to Medical Decode. Subscribe because next week's video can save someone you love. Your legs are the farthest point in your body from your heart, which means they depend completely on strong, steady blood flow to stay healthy. As we get older, the blood vessels in our legs naturally lose some of their elasticity, and the tiny one-way valves inside our veins can start to weaken. When that happens, blood doesn't flow back up to the heart as efficiently as it used to. Instead, it pools in the lower legs. Legs equals your body's early warning system. This is exactly why circulation problems often show up in the legs long before they show up anywhere else, and long before a routine checkup would ever catch them. Your heart could look perfectly fine on paper. Your blood pressure could read completely normal, and yet your legs could already be quietly struggling because circulation problems tend to start at the farthest edges of the body before they ever become visible in a lab result. The tricky part is that in the beginning, none of this actually hurts. It just feels like getting older, a bit of heaviness by the end of the day, ankles that seem slightly puffier than they used to be, legs that fall asleep faster when you sit for a while. Because none of it is painful, almost everyone brushes it off. But your body is sending a very clear signal, and today we're going to decode exactly what it's saying, why it happens, and most importantly, exactly what you can do about it starting today. Let's talk about why doctors so rarely walk you through this. It's not because they don't know. It's because a standard appointment is often only 10 to 15 minutes long. And in that time, a doctor has to review your medications, check your blood pressure, ask about any urgent concerns, and move on to the next patient. Explaining the biology of venous valves and daily circulation habits simply doesn't fit into that window. So it gets left out. Not because it isn't important, but because there isn't time. That's exactly the gap this channel exists to fill. Let's talk about the 3 signs that most people notice but completely ignore. The first is evening swelling around the ankles. If you take your socks off at the end of the day and there's a deep mark pressed into your skin, that's not just tired feet. That's fluid pooling because blood isn't returning to your heart the way it should. Sign number 1, evening ankle swelling. This kind of swelling tends to be worse after standing for long periods, worse in hot weather, and often looks better again by morning after a night lying flat because gravity has stopped working against your circulation for a few hours. The second sign is cold feet, even when you're sitting in a warm room. When circulation slows down, your extremities are always the last place to receive warm blood. So persistently cold feet, even at rest, even under a blanket, is something worth paying attention to. Sign number 2, cold feet at rest. Many people assume cold feet are simply poor circulation from birth, or just how my feet have always been. But if this has gotten noticeably worse over the last few years, that change itself is meaningful information. And the third sign is nighttime leg cramps. That sudden sharp tightening in your calf that wakes you up, sometimes strong enough to make you jump out of bed and press your foot against the floor for relief. These cramps are strongly linked to reduced circulation and to shifts in minerals like magnesium and potassium that become more common as we age, partly because of changes in diet, partly because of certain medications, and partly because the muscles themselves are getting less oxygen-rich blood overnight. Sign number 3, nighttime calf cramps. None of these 3 signs are an emergency on their own, but when you notice them together, repeated over weeks or months, they paint a very clear pattern, one that's worth addressing early while it's still simple to fix, rather than waiting until it becomes a bigger problem that requires medical intervention. So what's actually happening inside your veins? Deep inside your legs, there are tiny one-way valves whose entire job is to push blood upward against gravity back toward your heart. Picture them like tiny trap doors spaced along your veins. They open to let blood pass upward, then snap shut to stop it from falling back down. Over the decades, these valves can weaken, a condition doctors call venous insufficiency. When the valves don't close properly, blood slips backward instead of moving forward, and it pools in the lower legs, creating that pressure, that swelling, and that heavy feeling so many people over 60 describe. Weak valves equals blood pools instead of returning. This is different from a blocked artery, which restricts blood flowing down into the leg. That's a separate condition called peripheral artery disease, and it has its own warning signs, like pain while walking that goes away with rest. Venous insufficiency, on the other hand, is about blood struggling to get back up. And while both conditions matter for your health, venous issues are far more common after 60, affecting a large portion of adults in this age group to some degree. And thankfully, they're also far more manageable with the right daily habits, which is exactly what we're going to walk through next. Before we get to the fixes, it's worth understanding who tends to be affected the most. Standing or sitting for long stretches, whether from the desk job earlier in life or simply spending more time seated in retirement, puts extra strain on these valves over the years. Carrying extra weight adds pressure to the veins in the legs as well. A family history of varicose veins is often a strong signal, since valve strength does tend to run in families. And previous pregnancies for women can also weaken these valves permanently, which is why some women notice circulation changes in their legs decades after having children. None of this means circulation problems are guaranteed. It simply means some people have a bit more reason to be proactive about the habits we're about to cover. Now let's talk about what you can actually do about it, because this is the part that matters most. And the good news is that none of these habits require special equipment, a gym membership, or a big lifestyle overhaul. The first habit is something called the ankle pump. Sit or lie down and simply flex your foot up and down, pointing your toes away from you, then pulling them back toward your shin, about 20 times twice a day. This activates the muscles in your calf, which act almost like a second heart, physically squeezing and pushing blood back up toward your chest with every contraction. You can do this while watching television, while sitting in the waiting room, or first thing when you wake up before even getting out of bed. The second habit is elevating your legs above heart level for 10 to 15 minutes a day. Even lying on the floor with your legs resting up against a wall works beautifully, and it gives your veins a real break from fighting gravity all day. Many people find this especially helpful in the evening after a full day of standing or sitting as a way to reset before bed. The third habit is walking, and it doesn't need to be intense. Even 10 minutes of walking makes a measurable difference because consistency matters far more than speed or distance. 6 daily habits, just 10 minutes a day. Walking naturally activates that same calf muscle pump we just talked about. And doing it daily, even in short bursts around the house or the yard, adds up to meaningful improvement over weeks. The fourth habit is simply reducing how long you sit in one place. If you're sitting for long stretches, try to stand and move every 45 minutes to an hour, because circulation slows down dramatically after just 60 minutes of stillness. Something as small as standing up to stretch during a commercial break or walking to another room to get a glass of water can interrupt that slowdown before it builds up. The fifth habit is staying hydrated, because thicker blood, which happens when you're dehydrated, moves less efficiently through your veins, making the valves work harder than they need to. A steady intake of water throughout the day, rather than large amounts all at once, tends to work best. And the sixth habit is paying attention to sodium in the evening, since a high sodium dinner can make overnight swelling noticeably worse, while a lighter, lower sodium evening meal often means waking up with less stiffness and puffiness in the morning. This doesn't mean cutting out flavor entirely. It simply means being a little more mindful about processed and salty foods, particularly later in the day. Some people also find gentle support from wearing compression socks during the day, particularly on days involving a lot of standing or travel. These work by gently assisting the veins' natural pumping action from the outside. They're inexpensive, widely available, and worth asking a pharmacist about if swelling has become a regular part of your day. Let's also talk about nutrition, because what you eat plays a bigger role in circulation than most people realize. Foods rich in flavonoids, things like berries, citrus fruits, and dark leafy greens, have been linked to stronger, more flexible blood vessel walls over time. Foods high in potassium, like bananas, sweet potatoes, and leafy greens, help balance sodium levels in the body, which directly affects how much fluid gets retained in your legs. And foods containing natural nitrates, like beets and pomegranate, are often mentioned for their role in supporting healthy blood flow. None of these are magic cures on their own, but combined with the daily habits we already covered, they add another layer of support. On the other hand, heavily processed foods, fried foods, and excess sugar tend to work against circulation, not because of one single ingredient, but because they contribute to inflammation throughout the body over time. And inflammation makes it harder for blood vessels to function the way they should. Let's clear up a few common myths while we're here, because misinformation around circulation is everywhere. Myth number 1, only overweight people get circulation problems. That's simply not true. While extra weight can add strain, plenty of people at a completely healthy weight develop venous insufficiency purely due to genetics and age. Myth number 2, if it doesn't hurt, it's not serious. As we covered earlier, the early stages of circulation problems are often painless, which is exactly why so many people ignore them until they progress further than necessary. And myth number 3, nothing can be done except surgery. In reality, the vast majority of everyday circulation complaints in people over 60 respond very well to the simple daily habits we've already discussed. Surgery is typically reserved for more advanced or specific cases, not the common heaviness and swelling most people experience. Sleep position matters here too, and it's something almost nobody mentions. If you tend to sleep with a pillow under your knees or with your legs elevated even slightly on a wedge pillow, you may notice less morning stiffness because you've given your circulation several extra hours of gravity assistance overnight. Some people even find that switching which side they sleep on makes a small difference, simply because it changes how much pressure is placed on certain veins for hours at a time. It's also worth mentioning medications, briefly, because certain common prescriptions, including some blood pressure medications and anti-inflammatory drugs, can contribute to fluid retention as a side effect. This isn't a reason to stop taking anything on your own, but if you've started a new medication around the same time your leg swelling increased, it's a completely reasonable thing to mention at your next doctor's visit, since sometimes a simple adjustment can make a real difference. Stress deserves a quick mention as well. Chronic stress raises cortisol levels in the body, and elevated cortisol over long periods has been associated with changes in blood vessel function, including how efficiently blood returns from the legs. This doesn't mean stress alone causes circulation problems, but it's one more piece of the puzzle. Another reason why the simple, calming daily habits we've discussed, like a short walk or a few quiet minutes with your legs elevated, do double duty for both your circulation and your overall stress levels. Of course, it's important to know when this is more than just an ordinary part of aging. If you ever notice swelling in only one leg, not both, or skin that feels warm, looks red, or is painful to touch, or sudden and severe pain, or a sore on your leg that simply won't heal, please see a doctor right away. Those particular signs can point to a blood clot or a more serious vascular issue that genuinely needs prompt medical attention. And home remedies are not the answer in that situation. This is the one exception where waiting and trying home habits first is not the right approach. But for the everyday heaviness, the mild evening swelling, and the occasional cramp that so many people over 60 experience, the habits we just walked through are genuinely effective. Doctors do recommend exactly these steps. They simply rarely have the time in a rushed 10-minute appointment to explain the why behind them the way we just did today. Understanding the reason behind a habit tends to make people far more likely to actually stick with it, which is really the whole point of this channel. Not just telling you what to do, but helping you understand your own body well enough that the habit makes sense and becomes part of your routine, rather than one more instruction you forget by next week. Think of it this way. Your circulatory system has been quietly working non-stop for 60, 70, maybe 80 years without a single day off. A few minutes of intentional care each day isn't a burden on a system that's given you decades of service. It's simply returning a small favor. Let's quickly answer a few questions that come up again and again in the comments on videos like this one. First, does this affect one leg more than the other? It can, and it often does, simply because most of us favor one leg slightly when standing or sitting, putting a bit more strain on it over the years. A small difference between your two legs is common and usually not a concern, but a sudden dramatic difference is exactly the kind of one-sided change we mentioned earlier that deserves a doctor's attention. Second, does this get worse in hot weather? Generally, yes. Heat causes blood vessels to dilate or widen, which can make it slightly harder for those already weakened valves to keep blood moving efficiently upward. This is why so many people notice more swelling in the summer months. And it's a good reason to be a little more consistent with these daily habits when temperatures rise. Third, can this improve or does it only get worse with age? The honest answer is that some age-related changes in your veins are permanent. But the symptoms, the swelling, the heaviness, the cramping, respond remarkably well to consistent daily habits. Most people who commit to even 3 or 4 of the 6 habits we covered notice a real difference within 2 to 4 weeks, particularly in evening swelling and nighttime cramping. And fourth, is walking on a hard surface different from walking on a soft one, like sand or grass? Not meaningfully for our purposes today. What matters most is simply that the calf muscles are contracting and releasing rhythmically, which happens whether you're walking on pavement, on a treadmill, or around your own living room. The surface matters far less than the consistency of doing it daily. One more thing worth mentioning. A lot of people ask whether they need to do all 6 habits at once to see results. The honest answer is no. If 6 new habits feels overwhelming, start with just one. The ankle pumps are the easiest place to begin, since they take less than 2 minutes and can be done sitting right where you are. Once that becomes automatic, usually after a week or 2, add the second habit, then the third. Health changes that last tend to be built this way. One small, sustainable layer at a time, rather than trying to overhaul everything on day 1 and giving up by day 5. There's no prize for doing it perfectly from the very first day. There's only benefit in still doing it in some form 6 months from now. It quotes, also worth saying clearly, this video is meant to help you understand your body better, not to replace a conversation with your own doctor who knows your specific health history, your medications, and your individual risk factors. Use everything we've covered today as a starting point for that conversation, not a substitute for it. If you bring up evening ankle swelling or nighttime calf cramps at your next appointment using the exact language we discussed today, you may find your doctor has a lot more to say about it than you'd expect. Sometimes all it takes is asking the right question to open up a much fuller conversation. Small, consistent changes, a few minutes of ankle pumps, 10 minutes of walking, legs up for a quarter of an hour in the evening, a bit more water, a little less sodium at dinner, rarely feel dramatic in the moment. But circulation is one of those areas of health where small daily deposits genuinely compound over weeks and months, often showing up as less evening swelling, warmer feet, fewer nights interrupted by cramping, and simply feeling lighter on your feet by the end of the day. If this helped you understand what your legs have been trying to tell you, hit subscribe, because next week we're decoding another everyday symptom that's more important than most people realize. And if you've noticed any of these 3 signs in yourself, leave a comment below. I read every single one.